When Profits Kill, the Deadly Costs of Treating Healthcare as a Business, our daily take. And in it, I point out basically that we are the only country in the world that inserts for-profit health insurance companies between people needing health care and people providing health care. That's it, or at least the only developed country in the world. Now, I realize you could argue that Switzerland does, because Switzerland's system is entirely privatized. But the companies that provide health insurance in Switzerland are heavily regulated, and the majority of them are nonprofits. So there's really nothing like UnitedHealthcare anywhere else in the world. A company that makes billions of dollars a year in profits, that is reportedly at the very top of all of the health insurance companies in America in denying claims. So here we are. What do we do about this? Well, actually, there's even a larger picture here. And the larger picture is, what is the purpose of government? Why is it that every other developed country in the world has universal health care? And arguably even Switzerland. Every other developed country in the world does, and we don't. We have 25 million people in America who have no health care. And if Trump keeps the promises of Project 2025 and his own promises to gut the Inflation Reduction Act, you're going to see that 25 million Americans with no health insurance go up to 30, 40, 50, maybe as many as 60 or 70 million Americans as they dial back on Medicaid, which, by the way, is a single-payer health care system. It's just not universal. The United States government, well, we pay a little over $12,000 per person per year, we Americans. Man, woman, and child, everybody in the country, we pay a little over $12,000 a year for health care. In the average of all the other developed countries in the world is around $6,000, about half. Which means that about half of those developed countries spend less than $6,000. About half of them spend more than $6,000. The closest to us, the most expensive healthcare country in the world, is Germany. They spend around $9,000 a year for healthcare. So why are we spending $12,000 a year? It's so the CEO of UnitedHealthcare can make $10 million a year. This is not rocket science. And not just UnitedHealthcare, obviously. And the for-profit hospitals and the big drug companies. And the pharmacy benefit managers, another category that literally does not exist in any other developed country. It's like there's all these leeches that have inserted themselves between average Americans who need health care and physicians who are providing health care. And they're all trying to make a buck off it. Now, what is the purpose of government? The founders of our republic tell us that the purpose of government is to provide for, life, liberty, and the pursuit of happiness. To meet the needs of the people in a way that allows them to get on with the business of life. And I don't think you can identify anything more essential to life, liberty, and the pursuit of happiness, than being healthy. Not only do we spend twice as much as the average of all the other developed countries in the world on health care, but we have the developed world's highest maternal mortality rate. We have the developed world's highest infant mortality rate. We have, for several years now, we've had a declining lifespan. Now, America is really a mess. We're like the sick child of the world. And now you've got Trump coming in saying, we're going to make it worse. We're going to give even more money to these giant health insurance leeches. How are they going to do that? Well, they want to make Medicare Advantage. Medicare Advantage is, one of the major profit centers for UnitedHealthcare and for all the other insurance companies that provide it. We're going to make Medicare Advantage the default for Medicare. We used to have a nice single-payer system for seniors. It was called Medicare. Now, fewer than half of American seniors are on Medicare. Most of them think they're on Medicare, but they're not. They're on private insurance. It has the word Medicare in its name, Medicare Advantage, but it's not Medicare. It's paid for by the Medicare Trust Fund, and it costs about 6% more to Medicare than real Medicare does. Does that mean that Medicare Advantage provides more services or benefits? No, they provide less or fewer. We spend in the United States, we're spending over the next decade, if nothing changes, we will spend between $50 and $60 trillion on health care over the next 10 years. If we had Bernie Sanders' Medicare for All, single-payer system, which, by the way, would cover everybody. There would not be 25 million people without health insurance. It would cover dental, it would cover vision, it would cover psychiatric and psychological services, it would cover hearing. It would fill in all the cracks. There would be no 20% deductible or whatever that you need a Medigap policy for. If we had all that, it would cost us $32 billion over the next 10 years. Now, you'll actually recall back when Bernie was proposing this and running against Hillary Clinton in the primaries back in 2016, the Clinton campaign was running ads going, Bernie Sanders' program will cost $32 trillion over the next 10 years. Holy cow. Without mentioning that if we just keep the system we have, Obamacare, it'll cost $55 to $60 trillion. They just made it look like Bernie was like Mr. Big Spender. The reality is every other country in the world has figured this out. Why haven't we? Well, because 5 Republicans on the U.S. Supreme Court legalized the bribery of politicians. It's real simple. What do we do about this? Well, obviously, we have to get big money out of politics. Which reminds me, there's a federal law that says that federal contractors cannot contribute to any federal campaign, to federal campaigns, including the president. How did Elon Musk, who owns SpaceX, which is a federal contractor, get away with basically buying the election with $270 million of his own? Isn't that illegal? Anyhow, I'll be right back with you 15 minutes past the hour.